Careful, everyone. We're going live.
There you go. See, look.
Okay.
There you go. See, look.
We are live on YouTube.
There you go. See, look.
We are live on YouTube. Is everybody there? Please check in.
Yep, here.
Laura's here.
I'm here.
And I'm here.
Zach, you're there too?
Sue is very
Yes.
quiet.
Yes, I'm here.
Sorry, I didn't say. Is that better?
Yeah, we're there. We're having some problems though. I can't control the feed. What's going on here?
Hi, Judy. Said my mic is way down. Is that?
I can put you up.
Is this better? Alex?
Yes.
Okay.
Much
Thank
better.
Thank you.
For those of you that are joining us on YouTube right now, we are having some technical difficulties. Can somebody hack into my account and send an email out to everybody telling them to search for John Goehle on the YouTube feed for today's YouTube Live? Oh, actually, it just said it. Send it to everybody that's interesting. Just send an email to everybody that is signed up for that account. Maybe I should
Okay.
just leave it there. Has everybody had a chance to review the script? Oh, everybody's muted, I see.
John, I'm having trouble I had the script up and now I lost it.
Okay,
How do I get back to it?
hang on one second. I've got to mute. What's happening with our second studio? For some reason, I have to
Check
mute.
the chat, Laura. I just put the link in the chat.
It's coming up here.
Thank you.
Nope, no problem.
Now you can.
Alex, does everybody see the chat? Do you know, like on YouTube? Not just us.
No, nobody else can see the chat. I'm
Okay.
watching on YouTube right now,
Okay.
and they can see. You ready for this trippy? Oh, no, I can't turn it off. Not working. I'm going to try to show you the feed.
Okay, what I might do is I might ask you to cut your videos at the beginning so that I can keep people on, so I can show Studio 2.
Mine is, it's there on mine. Oh, I
Pardon?
forgot it.
Yeah, right
Yeah.
now the feed that's going out is this. When I switched it over to speaker view, it
They're
kept
all
switching.
leaving.
Yeah, well,
Does that open
He
it
said
up?
to do that.
yeah.
Yep. No,
that,
that's fine.
that way we can, then you can open it up later. That's
Mhm.
fine.
Yeah, I just can't tell because to me it looks just normal anyway.
Yeah, and I'm going to cut yours over there. You can do it
Okay.
later, but I thought I had more control, but I guess I don't. It is what it is. Okay, thank you, everyone. We are at 10 minutes of. We're going to start the Podbean feed. Hang on, stand by. We are live on Podbean. Coming up on 9 minutes to live. We have nobody on Podbean yet. Can anybody see how many people we have on YouTube?
Hi, Danielle. I'm fine. We're about
3.
to start this
Hey,
podcast.
Judy.
What's
You
up?
got mute.
Sorry.
It looks like we have 3, but I'm guessing one is me, one is Zach.
Yeah, we might not have anybody yet. Okay, that's all right. So those of you that are listening on Podbean, which is nobody, and we're starting to get some people here. So this is John Goehle with the ASC Podcast with John Goehle. We are live. We're waiting for the show to begin at 4 o'clock sharp Eastern Time. If you're joining us on the live feed from Podbean, we also have a live YouTube channel. To access it, go to YouTube and search for John Goehle. That's spelled Goehle. Just a little hint, you might want to look at the video feed today. If you don't see it live, you can see it recorded afterwards, but we have a special thing going on today. We're at 8 minutes to showtime. I show everyone muted but me. Thank you. Laura, can you change your name on the screen? Oh, wait a minute. I can do that for you. Hang on. We're at 7 minutes. We have 7 people on Podbean right now. Any idea on YouTube?
Are we all muted?
You're not muted.
Okay, but I mean, so they can't.
Yeah,
answer.
Oh, I'm sorry. Well, they can unmute to answer my question.
Okay, sorry.
3 people on YouTube currently.
Okay, thank you. And actually, if you could just periodically put it into the chat, how many people are on? Thanks. Oh, thank you. You're doing that. Never mind, Zach. For those of you that are joining us, this is John Goehle with the ASC Podcast with John Goehle. And we are coming up on 6 minutes to going to beginning the show. I'm going to throw some music on in the background here. She's what? Judy, in the background there, be prepared for going live at exactly 4 o'clock. I'll give you I'll give you the go ahead.
I think Rosie's just in the makeup room.
Green room. This is John Goehle. We're at 5 minutes. If you wish to join us on YouTube Live, you can go to your YouTube and search for John Goehle. That's Goehle. You can see a live feed. We do have a special guest today. We're at 4 minutes and 30 seconds to live. I have somebody trying to call in. Can you text me as to who that is? Pardon?
Should I just go right now?
Yeah.
And then
Just don't go onto the screen though, because they'll see.
Okay, and you're gonna like.
You'll hear me.
Okay, because I'll leave the door open.
No, keep the door closed.
Oh, I have the speaker. I forgot.
This is John Goehle with the ASC Podcast with John Goehle. We're at 3 minutes to beginning our episode here. If you want to watch a video feed, a live video feed, we can go to YouTube and search for John Goehle, Goehle, and you can get a live feed of the show. It is 15 seconds delayed from the live pod being though. We do have a special guest today who you might want to see on video. We're at a 2-minute warning. Can I get a thumbs up from everybody that is ready? Go, Judy.
Hello and welcome to episode 97 of the ASC Podcast with John Goehle for March 23rd, 2020. Recording live from our studios in Spencerport, New York. We would like to thank our sponsors, Ambulatory Healthcare Strategies, Surgical Information Systems, Encompass Healthcare Data Solutions, and BHG Funding. For more information on our sponsors, please visit our website. This is Judy D'Ambrosio, Director of Educational Services for Ambulatory Healthcare Strategies. Joining us from Studio One is John Goehle, recognized as one of the nation's leading experts in the ambulatory healthcare industry. Joining us from Studio 2 is Sue Concrete, Chief Researcher for the ASC Podcast with John Goehle, and along with her is Rosie Cronkite-Goehle, Director of Therapeutic Services from AHS. Joining us remotely from Rochester, New York is Jenna Alvarez, our Senior Nurse Consultant, Alex Borneman, Director of Operations with AHS, and from Cape Cod, Massachusetts, Lori Rodriguez, Director of Clinical Services for AHS. From Atlanta, Georgia, we have Zach Caloritas, Financial Consultant with AHS, From West Palm Beach, Florida, Ann Geyer, Chief Nursing Assistant with SIS. And our special guest from Syracuse, Laura Spring, Esquire.
I would like to thank everybody for joining us today. I hope you had a good weekend as best you can. As you probably know, it's been a very eventful weekend. One of the things that we have some joy in our lives, and I would like to introduce the new Director of Therapeutic Services for Ambulatory Healthcare Strategies. She is with Sue. And yes, she is a four-legged dog. I know for all of you that are on the podcast that cannot see, we have this beautiful little 8-week-old puppy. She's a golden retriever, cream-colored golden retriever. So you might, if you didn't join us on YouTube, you can certainly come back and see the video afterwards. But she's brought a lot of joy to our life, and she is a little mischievous, but she's also been a very good puppy. So Director of Therapeutic Services for Ambulatory Healthcare Strategies, welcome. Okay. I thought I would just bring some joy to our lives here. I know that there's a lot going on, and sometimes it's nice to see something different. So I'm going to change the feed here. So it has been quite an interesting weekend, and I just want to start by just talking a little bit about what happened in New York. And a number of people said it doesn't matter. I mean, we have people from other states that have just noted that New York tends to be kind of leading the way with regard to what's going on. So unfortunately, over the weekend in New York, some guidance came out from the New York governor's office that defined essential services. And unfortunately, this went out. What happened is when this guidance came out, it did not include ambulatory surgery centers. We hope that this was an oversight, but in light of it, we are recommending to all of our centers to file an exception. And we did provide information this morning on our website as to what the step was for doing this. We are advising those centers that believe that they're under a shutdown order to continue services if they so wish, but to file this exception just to be sure. So there's a lot going on in many of the states, and many of the states that we work in, unfortunately, are indeed starting to require that ambulatory surgery centers stop doing non-elective procedures. Alex, do you want to give an update on what's going on across at least with the most common states that we have?
Absolutely. So we're going to start with California, which as far as we've seen has not released guidance specific to elective procedures. But however, they have released guidance having to do with which workers in different industries should be reporting to work. And among those are workers in other medical facilities, including health or ambulatory health and surgical. That's the way they put it in their release. Florida has determined that ASCs are prohibited from providing any medically unnecessary, non-urgent, or non-emergency procedures or surgery, which, if delayed, does not place a patient's immediate health, safety, or well-being at risk, or will, if delayed, not contribute to the worsening of a serious or life-threatening medical condition. So you can see they're really being very specific there. And then Massachusetts has determined that ASCs in Massachusetts must use their clinical judgment on a case-by-case basis regarding any invasive procedures that must be done to preserve the patient's life and health. Additionally, the guidance defines non-essential elective invasive procedures to mean procedures that are scheduled in advance because the procedure does not involve a medical emergency. However, the ultimate decision is based on clinical judgment by the caring physician. New York has very similar guidance. It identifies, or it asks ASCs to identify procedures that are deemed elective by assessing which procedures can be postponed or canceled based on patient risk, considering the emergency need for redirection of resources to the COVID-19 response. They're also canceling all elective non-critical surgery for hospitals. And then in Ohio, they have determined all non-essential or elective surgeries and procedures utilizing PPE must not be conducted. It also describes that non-essential surgery is a procedure that can be delayed without undue risk to the current or future health of a patient, and notes that healthcare and public health operations shall be construed broadly to avoid any impacts to the delivery of healthcare, broadly defined. And in Pennsylvania, on March 17th, DOH announced that hospitals should review all scheduled elective admissions, surgeries, and procedures and develop a plan to postpone or cancel those admissions, surgeries, and procedures if they have not done so already. And then on March 19th, Governor Wolf issued a new order prohibiting the operation of all businesses that are not life-sustaining businesses. And this list provides that hospitals and ambulatory care services may continue physical operations, but elective procedures are prohibited. And finally, Texas, which Governor Abbott has released an executive order directing all licensed healthcare professionals and all licensed healthcare facilities to postpone all surgeries and procedures that are not immediately medically necessary to correct a serious medical condition of or to preserve the life of a patient who, without immediate performance of the surgery or procedure, would be at risk for serious adverse medical consequences or death, as determined by the patient's physician. Finally can take a breath. So a lot of those are very long-winded, and they definitely, I read them out particularly because the specific language used within that is very important for each surgery center when they're looking at the guidance from their state to determine what is an elective procedure or an urgent procedure, depending on their state.
And we will post the link when we on our website later on.
Absolutely.
Your video is on.
And
Okay.
and a lot of that comes from ASCA as well, from that link. So that'll be where it'll be directed, and it has more. We stuck mostly with the bigger states there.
Very good. Hang on, sorry. So let's go and move on to talk about deciding to close or not. I do want to reiterate our advice at this point is that we still feel that the physicians are responsible for defining what are essential or non-elective services. And this should be done using the board meeting template and forms that we've provided for each case. Recognize, however, that there are probably going to be lawsuits later that will call into question your decision. So be prepared for it to be able to be prepared to justify your decisions. It is imperative that you have a sound basis for any of those decisions and that you don't make a blanket decision that all of your procedures are essential. And I know our physicians would like to believe that everything that they do is absolutely essential for the patients, meaning that it needs to be done urgently. It's also important that you maintain a log, as we've talked about before, of all cases that you cancel to show that you are assessing all these cases and that you have some proof behind it. We've provided an example log on the action plan website at ascpodcast.com. We must note, however, that you could be subject to significant legal consequences by staying open. There are a number of potential penalties that you could be subject to in addition to the lawsuits that we mentioned earlier. And doing cases like routine arthroscopies, diagnostic GI procedures, most plastic surgeries, et cetera, will be somewhat easy to show are non-essential. This is even more of an issue if you have some type of exposure to the sun. In other words, if somebody in your center has tested positive for the coronavirus. And by the way, I believe we have, I think we have 4 centers now that have had individuals that have tested positive for coronavirus. And most of those are, well, actually all of them are on quarantine right now. The staff is on quarantine. Laura, do you want to chime in a little bit here on some of the legal consequences of this?
Sure. So in New York, Section 12 of the public health law provides that could be severe violations if you were to be deemed doing elective surgeries. Some of the violations carry a civil penalty of up to $2,000 for a first violation, with increasing fines on a sliding scale up to $10,000, depending on the nature and the frequency of the violation. For instance, fines up to $5,000 may be assessed for a second violation within 12 months of the first, so long as the violation constitutes, quote, serious threat to the health and safety of an individual or individuals. That also states right now, again, this is all fluid. We don't know how any of this is going to be enforced at this point in time. A fine up to $10,000 may be levied if the violation, quote, directly results in serious physical harm to any patient or patients. So again, some serious consequences here. The AG, the Attorney General's office, also can obtain injunctive relief, which means they can basically come in and shut you down. And at this point in time, we're not clear as to whether criminal penalties will attach for any violations.
Yeah, and is it fair to say that when they say per instance or per, in other words, that would be for each surgery that you do?
Right, so that's a little unclear at this point, whether it's just being open is a violation or each surgery. We would obviously take the approach that it would be each surgery. We wouldn't chance it.
Right, exactly. So I think what the point we're trying to make here is be very, very careful. If you can, well, first of all, if you're doing business as usual, and there are some centers out there that are continuing to act as though this order does not mean anything to them, that they should continue, that they continue to do procedures on individuals as though there's no coronavirus or there's no mandate from the state. And I think you have quite a bit of legal risk here, moral risk, I think, too, and you're potentially endangering your staff and your patients. And that as we've talked about before, in the situation in which, afterwards, if somebody gets the coronavirus or God forbid, somebody dies as a result of getting the coronavirus in your center, I think that there are some significant legal problems that you might have in the future. Do you agree, Laura?
Certainly. And also just, the obvious, that the unknown, right? So we don't know where plaintiffs' lawyers will go with any of these things.
Right. Except that we know plaintiffs' lawyers love to sue us. So. And I don't say this, I do think we're in solid ground if we're doing truly cases that are, that you can really justify are done, that have to be done urgently in order to protect, the patient. But keep in mind, this decision is not easy. You have to also weigh it given any exposures that your patients might have had, or that your staff might have had to people that have been exposed to it. We're in very interesting ground here. And of course, we can't cover every state. I had Alex try to, put everything, forward from the states, and we could only do the ones that we know we have the largest audience from. And we will post that on the website, but you do need to double check, keep up with what's going on in your own state. Lori, you are on. Lori, if you can give us kind of let's talk about those cloth masks for a second.
Can you hear me, John?
I can. I'll just have to boost your sound a little bit. Go ahead.
Okay. Sorry, guys. I'm calling from a car. I know that there's been a lot of talk about the use of cloth masks, and in a lot of your neighborhoods, your communities, there are actually people that are making them and bringing them to your facilities, the hospitals, to the healthcare workers, which is a wonderful offering of their support to all of the healthcare providers. However, you got to remember that cloth masks really only protect you for a nanosecond. You're really exposing yourself and others to potential cross-contamination. You're not keeping out any of the pathogens. You are breathing, and the moisture from your breath is being absorbed into that cloth, which is now making it not necessarily impervious, but less impenetratable. So the bottom line is you really shouldn't use cloth masks, especially in the surgical area, and in any situation where you may be exposed to droplets or respiratory type offspring. I can't think of the right word, but you're not going to be protecting yourself, and you're certainly not going to be protecting someone else in the event that you are infected and don't know it. So if you can stay away from using cloth masks, I really, really encourage you to do so.
And Lori, one of the issues I think that we're seeing out there is that there's advice that people are being given, throughout about reusing paper masks, about using these cloth masks, and we have to be very careful. Even if it's official advice, it probably is not. It doesn't apply to a surgical environment.
Yeah, best practice is that you don't want to cause any cross-contamination.
Right.
And in your surgical arena, that's when the patient is at a very vulnerable time with an open wound, etc. So if you can avoid reusing any kind of mask, I don't care how well you clean it, in the surgical environment, that's my recommendation. In the clinical area or your environmental services, that's a completely different beast to look at. But again, it may not protect them. However, your patients need to be protected in their most vulnerable state.
Thank you, Lori. Any other comments about infection control at this point? Any observations you've had over the last 72 hours?
Not necessarily. I think that I think as a whole, our community, as in the ASC community, is really doing their part when it comes to the screenings of patients, the screenings of staff. I think that it does become an issue where there are some places that are saying if your staff are exposed but don't have symptoms, they can go to work, that sort of thing. It's really hard, for hospital workers because they are on the front lines. They are really needed. I can understand that way of thinking, but in our ASCs, where I know now we're calling some of our procedures urgent or medically necessary, do we really want to risk exposing anyone else if there's a chance that one of our coworkers could turn positive because they have been potentially exposed to someone with the virus? So that's a lot of internal thought and consideration that I think leadership and governing bodies need to come to a unanimous decision for each individual center.
Thank you. By the way, I just want to remind our listeners that there are many ways that you can ask questions here. One is you can call in. If you wish to call in, please text within the app first on Podbean Live. Unfortunately, there is no mechanism for our listeners on YouTube Live. On YouTube Live, there's no way that you can call in, but you can text, you can put a message into the comments there in the chat. And you can also email us at comments at ascpodcast.com. We're monitoring all those channels. And if you're one of our clients and just have a question for any of our, for us, just email your regular contact and we'd be glad to answer it. So I know this next area is probably going to have a lot of questions. And I did want to introduce Laura Spring again. She is an attorney. Laura, can you just tell a little bit about yourself and your practice area?
Sure. So I'm a member of CCB Law in Syracuse, New York. Most of our practice revolves around healthcare clients. I do employment law and litigation. And so it's been an interesting week.
None of us are getting a lot of sleep right now.
Right.
I can promise you, even though I've had this puppy this whole weekend long, most of the time I was on a phone while I was holding her. She's very patient though. So what we want to talk today about and what our listeners have been asking about is issues around furloughing or laying off employees. And we did mention on Friday's episode that you should be using the term furloughing. I think we put it in our updates and I think it's on the website. And so, Laura, can we start by talking about why you want to use a furlough versus laying off? And then we'll get in some more of the granular issues that we have.
Sure. So a furlough traditionally is that you want to keep the employees employed, but you are asking them to take an unpaid leave. This is, to retain our workforces, right? Because everyone hopes we're going to rev back up and we want our employees to come back to work. So the pros and cons of the furlough is that employees on furlough can't do any work at all for you. The minute that they do any type of work, any type of anything, whether it's emails, phone calls, you would have to pay them for that work. Obviously, non-exempt employees would be paid at their hourly rate. Now, when you get into exempt employees, then it gets a little more dangerous because they would be potentially allowed their full pay, even if they only worked a couple hours. So you have to keep very diligent in terms of not having your workforce work and keeping them as employees. Now, a couple things that go as opposed to a layoff, and we could talk about that also. Obviously, a layoff is someone is terminated from their employment and they could then collect unemployment, but then they would be subject to being rehired. And what goes along with that in terms of medical practices, it's not always that simple. You have credentialing and other things that you have to look at. However, the collection of unemployment is going to be important to some employees. And so you sort of have to look at the cost benefit analysis and also look at the needs of your employees. They may be perhaps more appreciative to be laid off rather than furloughed because of them being able to collect unemployment. The other piece is, benefits. You can continue benefits under either scenario. Obviously, under layoffs, they would be subject to COBRA, but on furlough, you would continue to pay benefits as if they were employed.
So I wanted to clarify, did you say that if they're on furlough, they're not eligible for unemployment?
Correct. That's my understanding in some of the states. Now, in New York, that's not so clear. We tell them apply for unemployment because, again, if you're not collecting any income under unemployment, you should collect unemployment, okay? But there's always the questions of whether you're quote unquote employed. The test is really if you're collecting any income. So that's why it's very important that employers are careful not to allow the furlough employee to collect any type of income.
Okay.
All right, so I just want to clarify that you would be entitled to the unemployment if you're not collecting any income,
Okay.
but it's dangerous
Or doing
on
any
furlough.
work,
Right.
yeah, or doing
Right.
any work that would make you eligible.
Correct.
Right.
Correct.
So again, reiterating that is that generally, if you furlough somebody, you are eligible in most states. And again, you're going to have to check your state, but in most states, you're going to be eligible for unemployment, assuming that there is no revenue stream at all.
Right, and
Hey,
assuming they relax some of the other rules, like, are you looking for work?
right.
Mhm.
And that's why things get a little gray,
Yeah.
you know.
But on a furlough, though, the employer is still paying for the health insurance and that type of thing?
Correct.
Okay.
So we do have a question. What about PTO before unemployment applies? I think what they're referring to is what happens if the person has PTO that they have not used yet.
Right, so if you have accrued PTO and your policy is that they would collect their PTO, they'd be owed their PTO time at the end of their employment.
So,
But
So-
can they, I think they're wondering if they're furloughed, if you know they're coming back, would they have to use that PTO? I wonder if that's what they're asking.
So if they would like to be paid, right, then they could use their PTO and then the furlough would continue.
Okay, but they could possibly save it until they come back, or doesn't that work with a
Well,
furlough?
that gets dangerous, right?
Yeah.
Because then you have a furloughed employee that's going to come back and take paid time off, which you don't want to do.
okay, so generally, I think what you're saying is that if they are on furlough, they're going to have to use their PTO first.
We would always run anything concurrently. Yes.
Okay.
Yes.
And another question, if furloughed, when we tell them the date they come back, do they have to come back that date? And then she also adds, can furlough use PTO? So maybe
That's the
that's
same
what she's getting at.
Right. So yeah, I mean, obviously, if you put people on furlough and you say come back to work on this date, they should come back to work on that date,
Mhm.
unless there's some other, scenario that would allow them to stay out.
Yeah. And I guess that does get tricky because meanwhile, you've been paying all of their benefits. If they choose
Correct.
to come back, you've
Correct.
Right.
lost.
Yeah, there are some risks here, of course. Do we have any other questions? Thank you for all the questions that we're getting. I'm trying to look at all the feeds here. I don't see anything else. Laura, the next questions that we have had to do with, do you have anything else to say about unemployment and the eligibility for unemployment in general?
Not really. I mean, unemployment's pretty straightforward. Right now, depending on the state, I would just recommend that, people have to be patient. In New York, they have waived the 7-day waiting period for unemployment. They do have some requirements and how to apply online, depending on your, the alphabet, what day you should go online because of the computers crashing. But it's pretty straightforward.
Okay, we do have another question about the furlough. 3 says, so you can require an employee to use their PTO before the furlough. Doesn't PTO belong to the employee and they have the right to choose when they use it, but can't be required to use it when an employee mandates?
And let me make sure I understand. The question is whether the PTO belongs to the employee and the employer can't mandate when they can take it. Is that the question?
I think she's saying, like, yes, if you say we're going to furlough you for a month, then maybe, and the employee had wanted to save their PTO.
Right. Well, they don't have that option necessarily because you're allowed to run any type of benefit like, FMLA, PTO, you're allowed to run it concurrently.
So it really is the employer, and we do recommend, or you recommend that the employer do pay out the PTO prior to their, as concurrently with the furlough.
Concurrently. So again, I mean, hopefully employers have employee handbooks that this is spelled out. I mean, these issues really haven't changed. Normal,
Right.
FMLA, ADA, paid time off, all should be running concurrently, so employers don't run into that issue of somebody going out and coming back and then taking additional leave.
Right.
The only time, like in New York, you can't run something concurrently is with, and we'll get into this a little bit, is with paid family leave.
Okay.
Because paid family leave does not it's not for your own serious health condition. You're taking leave for somebody else's health condition. So technically there is you could run like an FMLA and then a paid family leave, but it gets a little complicated, and we can help people out and through those issues. But right now, I don't think we're going to necessarily have those issues because of New York State has allowed employees to go right to paid family leave in this situation.
Okay. And I may be asking the same question again, but so if they apply for unemployment, but they're also getting their PTO paid out, is that you can still get unemployment even though you're getting that payment from the PTO, or do you have to use up all your PTO before the unemployment payments will kick in?
No, normally when you're terminated, you can apply right away for unemployment because the PTO is owed to you. It's not an additional, it's not like a severance pay. If it was a severance pay, right, you'd have to wait for that to be completed, those severance payments, until you applied for unemployment.
All right. Thank you.
Are you concerned that I'm going to lay you
No.
off?
I just think that's what people are getting, because you
No,
think
it's
of
a good
you're
question.
saving it
It's a
because
very
once
good
you get
question.
back from this craziness,
Yeah.
you don't want
Right.
to.
Now having said all of this, you have to look at the specific paid family leave and paid sick leave under the federal law that was just passed and under New York, because they don't want to take away people's paid time off.
Mm-hmm.
So they're giving you some paid time off in addition to the paid time off you have already. But that doesn't apply to what we were just talking about with unemployment. This is just if you're employed. Okay, so we can jump to that if you want.
Yeah,
There's no more
why don't
questions.
you go for that? And before we even get into that, because this is, we're starting to get into some real legal issues and of course state specific issues. We do really need to recommend that you get your attorney involved in this. We're trying to give you some
Like an overview.
And quick answers, but for your own specific circumstances, you really need to take the advice of your attorney. And I'm hoping that at least after this conversation with Laura, you'll be able to ask intelligent questions of your lawyer and perhaps get right to the point. Go ahead, Laura. Why don't you talk about the next subject?
Right. So I know it's and I apologize because this is very fluid information and everybody's trying to figure it out as we go along. So, it is a little confusing. We have up, I think, John, you've put on your site our link. So some of these issues you can go right onto our blog posts.
We haven't yet, but it will be up later tonight. Yes.
Good. Okay. So let's just talk a little bit about what New York State and the federal government has done to provide leave to employees affected by coronavirus. So New York has paid sick time plan, which was effective on March 18th. So it's in effect. And basically, New York's paid sick time plan is divided up depending on the amount of employees you have. So I can, again, be up on, we'll link to this, but basically if you have 10 or fewer employees and less than $1 million in revenue.
And what do you mean by revenue, by the way? Net income or gross revenue?
Gross revenue in the previous tax year.
Got it.
Okay, so you would be entitled, your employees would be entitled to unpaid sick leave until the termination of the mandate, okay? And job protection for the duration of the mandate. I say mandate, that is, the quarantine order. So if people, right now, if you're non-essential, you're at home, this would apply.
Correct.
So then after, there also would be the New York paid family leave and disability policies would kick in. So now you have to separate employees that are actually sick as opposed to employees that are just not allowed to come into work. So that's the first level, and it just goes up from there. If you have, 10 or more, 11 through 99 employees, and they get at least 5 sick days, paid sick leave, and unpaid leave until the mandate is over, or the period of quarantine, if you're being quarantined. And then you would be able to go to paid family leave and disability policies. There are caps on the amounts for the paid family leave. It's $2,884.62 per week. Okay, so you get an idea. And then you go to employers with 100 or more employees, and the employees are entitled to 14 days of paid sick leave. And this applies to public employers as well.
Okay. And we're talking about, these are the federal rules we're talking about here too.
Yeah, so this is just New York. So this is just New York. When you jump to the federal government, which is the First Families Coronavirus Act. So this has not taken effect yet. It takes effect on April 2nd. And this is a little more involved. And again, we recommend people go to the link because there's 6 different areas that you can that would apply. And this is where we get into, if your child's school is shut down and you have to stay home. So there's a lot of qualified employees here.
Yeah.
That act does not apply to employers that have 500 or more employees. We are, so generally the employee is eligible for up to 80 hours of leave. So that would be 10 days. And it goes, again, there's caps on that per day. $511 per day with a cap of $5,110 in aggregate over that 2-week period. There's different amounts, lower amounts if you're home because your child's school is closed down. But again, this is all, it starts getting sort of technical, so we would get to the link. But the important part is there are there are some federal guidelines now to try and bridge this gap between, people just being sent home, whether you're being quarantined, whether you're asked to work from home, the different scenarios that are taking place.
So we've had 2 questions here, and we are getting very granular, of course, and I'm sure that we've already lost some of our people, and we'll post these links, which will be a lot easier for you to read. And again, consult with your attorney. So let me ask these 2 questions, then I have an overall question. If our center is closed and staff are using PTO but have not yet been furloughed, are they eligible for these benefits? Once furloughed, are they not eligible? And I'm assuming.
So if they're employees, they are eligible.
And
if
if
they're furloughed, they're considered employees.
Yes.
Okay.
Yes, and this is where it's going to get a little sticky, right? Because we certainly employers going to have to make some very hard decisions right now.
Yeah. We also have a second question, which is somewhat similar. Are furloughed employees entitled to apply for any of these governmental pay benefits? And I think what you're saying is that they have to be furloughed in order to be able to do the benefits you were just talking about with the paid sick leave and FMLA.
Right. So remember, the first piece of that is the employer's responsibility. Then obviously, like in New York, the paid family leave would be, that's what's been taken out of your paycheck every week. Then that would kick in. But anything initial would be paid by the employer.
So when we send them home furloughed, which level of benefit do they apply for? I don't know if I understand that question.
Yeah, I don't understand that question.
And I guess they would go to unemployment and they would steer them in there.
Right. So,
Right. Go for it. I'm sorry. Go ahead, Laura.
So again, this is looking at specifically if you're working, right? And so you have not been terminated, right? And the paid sick leave is until, an order of quarantine or isolation is over. So you have to look, I think we're framing the question a little differently.
Mhm.
Because I think people want to know, they're asking about being furloughed, whereas, people are not working, but their benefits are continuing. So these would apply to them, as opposed to being laid off, where you would not be able to apply for these benefits.
So I guess my question is, obviously there's some significant financial ramifications for this, and keep in mind all of the centers that are listening are most likely between 10 and 100 employees.
Right.
More than half of them are less than 50 employees, indeed. So what are the financial ramifications of these decisions, and what types of things should we be looking at? I mean, we don't have a lot of resources to be able to pay out when we furlough people. So what types of responsibilities do you think we're going to have? Financially.
Well, that's really the hard question, because if you're going to have the economic obligation to continue benefits or pay out any benefit, as opposed to laying people off where you would not have that responsibility, that's really where you have to make the judgment call.
Yeah. And again, if you are furloughing employees, their benefits would continue. If you lay them off, you have a choice to continue the benefits, or I should say the
Correct.
health benefits.
Correct. But they would be entitled to COBRA nonetheless, but you may choose to
help them out
a little bit.
Yeah. Are there any other questions from our listeners? I will go on to another question that was not related. Thank you very much, by the way. We're going to bring you back in a second here. We did have a question that came in before this section. If an ASC has been used to hold and care for COVID-19 patients, how is the air handling system decontaminated prior to return to use as an ASC? One of our partners asked me that this weekend. So this probably is a Lori question, because she's such an expert on life safety and HVAC systems.
Yeah, well, I would defer that to our life safety expert who's not on the call. So I would imagine that would be something for one of those inspector type people to answer. But my guess is if we are taking care of known or probably COVID-19 patients or potentially infected patients, we might want to consider prior to bringing in a new batch of healthy people, once this is through, maybe changing out all your filters. But again, I would defer to someone that's really in the know, a ventilation expert. But that would be my first thought, all the filters would need to get changed.
I would agree. Yes. And a thorough cleaning of the facility, which I think is what you said, using one of the professional companies that knows how to clean for COVID-19.
Right. But specific to your ventilation, I don't know that you would have a cleaning company. You would have to have an HVAC system.
Right. The two things. You got to clean the place and then clean the filters that have been contaminated from the COVID.
And we have another question from the same person. He said, I've been asked if I would lend 2 anesthesia machines to a hospital. We would prefer not to do this until it is a mandate. Is this a reasonable response?
I believe Jenna's going to address that regarding ventilators, but I mean, any request is reasonable. It's just whether or not they want to do it.
Or if the government's going to mandate giving it over, which I believe is
New York. It's New York. Cuomo said that it was like required, but I haven't seen the actual writing of the requirement for licensed facilities to give their ventilators to people or to hospitals. in any of his executive orders. So I'm not sure where exactly that, how exactly they're enforcing that. But we are recommending that, especially if you're shut down, and you're not using them, because in New York, the wording, the way he said it is, if you're not using it, if you have it just sitting around, then that's when we want it. So I
And
did
we should talk about the national side too.
Yeah. So I did look up the Anesthesia Patient Safety Foundation has put out a statement about ventilators during the COVID crisis. And what they said is ICU ventilator shortages are expected to be a problem if the number of infected with ventilator failure exceeds the supply of the ventilators. Using anesthesia machines as an ICU ventilator is considered an off-label use, but certainly should be considered as a life-saving intervention. Each institution will need to determine how best to logistically use the anesthesia machines for long-term mechanical ventilation. Existing procedures for ICU ventilators for long-term humidification and replacement of filters and breathing circuits should be applied to the extent possible. Anesthesia professionals should be involved with modifying procedures and helping to manage the use of the device. At the time of this writing, manufacturers are expected to provide additional guidance on the topic. So I would look to see if your manufacturer of your anesthesia machine has released that guidance. The FDA also put out a statement about ventilators, and they said, this is more of like a last resort type of situation. But it says, if the number of ventilators in your facility is running low, consider alternatives. Healthcare providers should use their judgment based on the condition of the patient and the circumstance in the facility to choose the best option. For a patient needing ventilator, I can't say that word today. I don't know why. Anesthesia gas machines are capable of providing ventilation or assisted ventilation, may be used outside of the traditional use of anesthetic indication. Because of significant differences between the anesthesia gas machine and traditional critical care ventilators, use or supervision by an anesthesia provider is recommended. And then again, it says refer to the manufacturer for specific instructions for use.
Can I interject? I think that if our ASCs do lend out their anesthesia machines to the area hospitals to assist in this, I would implore you that when you get them back, that you have the company rep come in and do a thorough cleaning, replacement of all the parts that could be affected through this process, especially any of the breathing apparatus, filters, etc. When you get them back. And at that point, I don't know where the charges would go, it doesn't matter, but I personally would not take the machine back from the hospital with the hospitals telling me that it's been taken care of. I would want to make sure that my people are taking care of those machines so I know it was done.
And actually, I would argue that that is the requirement from a CMS standpoint, is that you can't trust anything that, that's true for any equipment that comes into the place, is that you're the one that has to do the biomed checks. You're the one that's taking the responsibility for the, for that machine and its functionality.
Yep.
Good point. Thank you.
So, and then if you're in New York State, the governor said, if you are a regulated health facility, we're asking you by order of the Department of Health to make that ventilator available. And there's a specific person you were supposed to call. Her name is Rachel Baker, and her number is 518-281-5120. If that's something outside of New York State, if that's something that you're interested in doing, I would definitely reach out to either the Department of Health or your local hospitals. I know some people have been told they aren't, been told by the local hospitals, thanks, but no thanks. That might change as, the demand for ventilators grows, but, you know, if you're not using it, it's something to consider. And in New York State, like I said, they're basically saying, you have to, if you're not using it.
Thank you.
Okay, thanks. And we do have another question for Laura. Somebody on YouTube wrote in, can we pay employees half-time while being furloughed, even though they are mostly at home?
No.
Yeah,
Okay.
that actually violates what we talked about earlier, that they can't work for you
Can't do
while they're furloughed.
Right. That's
Right.
right. Correct.
Laura, on our morning call, I'm sorry. I think it was you that brought up the question of reviewing all of your contracts to determine if you're obligated under any of the contracts or services when there's no volume. Can you talk about that a little bit? This is very, very important, I think.
Sure. So, again, we'll send a link to you because we'll have a blog post on our website regarding this. Again, like other things in the law, there's a lot of gray area here. This is probably unprecedented time for this issue to come up in contracts. That there is a what we call a clause that are sometimes included in contracts called force majeure, which basically means that when something is cannot be performed, that the contract will somehow the performance under the contract would be excused. Okay, so certain employment contracts and certain contracts, I'm sure there's employers out there with hospital contracts or other type of vendor contracts, that whether or not this would excuse performance under those contracts, whether those contracts can be terminated. If there is not a provision in the contract, we would then look to common law to determine whether or not something is impossible or difficult to perform, or whether or not there's what we call a frustration of purpose. So again, it gets somewhat technical and bogged down in legal jargon, but bottom line is we believe that most of the contracts out there are not going to have language that talks about an epidemic, and so we're going to be looking at common law to determine whether something can be performed or not, and it really is going to look at the standard being an unforeseen event that severely undermines the original purpose for entering into the contract, right? So they'll like I said in the link, you'll see the different scenarios where you could probably argue that the purpose of the contract can't be performed, and whether or not it's probably impracticable. So there would be a basic assumption that employment agreements, that ASCs or hospitals would remain operational during the entirety of the agreement. That's really what we're looking at.
I think just to kind of put it in a nutshell is that all of those provisions that we always ignored in the back of our contracts about what would happen if something major happened are those things that we're going to actually have to read now.
Right, and in New York, they're narrow and they're very strict in interpreting those in New York. So,
so this is the time to review those contracts carefully, especially if you wish to stop paying on them, or if you have to stop paying on them, and recognize that you could have some legal obligations. So, time to dig those contracts out and start considering what the ramifications of that are. I don't think that's a question.
I think she just wanted to clarify.
Yeah.
Because somebody had mentioned that earlier. It seemed that you said that an employee can be furloughed and an employee cannot work unless you pay them for that time only. So if they're furloughed, you can pay them for like a part-time.
But then they could potentially lose their unemployment
they can't.
insurance.
correct.
So they either are
That's
working
the
part-
challenge, right? That's the challenge. If you furlough them and then they do work and you pay them, they're going to lose the potential for unemployment.
Yeah.
And I think sometimes you can get partial unemployment, but I think then it just gets very,
could
very
get very
confusing,
complicated.
especially right now. There's the system's going to be overrun. I almost just wouldn't.
Correct.
Actually, that's a question. I don't know if any of our lists, I don't know if anybody has had any experience in trying to apply for unemployment. How difficult is it, at least in some of the states that we're representing here? Anybody know? Okay. Not surprised. Do we get all the questions? I think we did.
I think we did.
Okay.
Yep.
So moving on. Thank you, Laura. I do want to remind our listeners of the importance of going to our website. It has not been updated since Friday, so I do have to make some changes tonight based on what we've been talking about
I'm gonna
today.
add those links.
And also on our website is the morning update, which does have some of the links that Laura had was discussing here. Please, the other thing that would be helpful for us is we're going to probably go to every other day with live podcasts. In the meantime, if you can email us questions that or types of things that you might want us to talk about, we would be glad to find the right person. We are actually looking into bringing Nelson Gomes on. I missed him today to talk about some of the issues with regard to computer systems, because there's issues with regard to computer systems during this time. So we might have him on, and I might, unfortunately for poor Laura, I probably have to bring her back like constantly for this. So because I think that the legal issues are going to be quite ongoing. So do visit our website at ascpodcast.com and follow the links for the action plan. Do it periodically. I will try to update it tonight, but probably it won't be all done until later tonight. We have a question we have a call in from somebody. Can you just verify? Let's let her in. Hang on. Yes, Sobin, you are on. Sobin, you're on. Can you ask a question? Okay, I will disconnect. Lori, we had this question. You brought this issue up about social distancing in the waiting areas, the pre-op and the post-op. You want to talk a little bit about that?
Yeah, it was funny. I had to go to CVS the other day to pick up a prescription, and at the counter, at the pharmacy counter, they set up tables in front of the real counter to keep people back from the person that's going to be giving them their prescription, etc., which I found kind of interesting. They also had tape on the floor, first customer, second customer.
Yeah.
So they kind of spaced it out. And that's a very good point, because most of our centers, our front counter is almost kissing distance to our front desk personnel. So it's, we need to think of their safety. So maybe having a safe space for people checking in at your centers to make sure that there is no, they have that social distance. It may not be 6 feet, obviously, but any distance is better than on top of each other. My husband was at a place.
Ooh,
I'm
Katie,
sorry.
Go ahead.
He found that the center where you were, if you signed in, you had clean pens. When you use that pen, it was deposited into a bin, which then they got sanitized or whatever, so that you weren't reusing pen to pen to pen. So you're not touching someone else's contamination sites, whatnot. In the waiting area, if we could possibly reconfigure the seating, or which is hard, you can't really hide chairs, but if we were to block off every other chair as a do not sit here, so that we're providing our patients that are waiting, or if there are family members in the waiting area, a little bit of space between each other, that would be a recommended practice. If you're in your clinical area, another thing to consider, since I'm sure our numbers are down, let's not put patients in bays right next to each other. If you can do every other bay, especially those of us that have curtains instead of walls between between patients. It's, you know, things like that to consider. Making sure that the bays don't have supplies in them out in the open, because, you know, this is airborne. We don't want it resting on our products that we're then going to open for the next patient. So it's kind of thinking like that, which is not necessarily social distancing, but it kind of is when it comes to our you know, like our IV start kits or something like that, you know. So if we can just bring over the things that we need at the time that we're going to use them, I would, you know, look into that possibility. It was interesting today. I was at a facility that has a common lobby, and there were people in the lobby that, whether they were there for the ASC or for physical therapy or one of the other services within this building, that were in the lobby. And, you know, part of you would thought that they were social distancing due to the loudness of their speaking to each other, but they were actually like right on top of each other in the lobby. So they weren't practicing social distancing. And, you know, we can't control that, but, you know, anything that we can do to help prevent this spread would be, you know, appreciated, I think is the word I'm looking for. You know, so, you know, think about in your center how you can keep people away from each other. And it's to protect them and it's to protect you as well. I mean, it's just a safety thing. And even nurses at the nurses station or whatnot, you know, we really have to think about, you know, that sort of stuff now. So hopefully that's helpful.
Absolutely. You know, I do one thing that I wrote to all of our clients this morning, and I'll just read it off, is during this difficult time, it is important that we remember our moral obligations as healthcare providers and our responsibility to protect the health and the safety of our patients and our staff. It is our position that unless you have a very strong case for the urgency of a procedure, you should curtail operations in those locations where the government has ordered non-essential services to be curtailed. After this is all over, we're going to be evaluated based upon our actions, and those organizations that chose to continue their regular operations as though nothing happened will likely suffer a diminished public image as well as possible fines, penalties, and lawsuits. So I just felt that we just had to put that out there, that we just be very careful out there. The future, the reputation of the industry really hangs on the way that we present ourselves during this time. And there is that perception, I feel sometimes, that, you know, that there are some centers that are just making some decisions that I think are poor because, you know, from a financial standpoint, you know, they do not want to suffer the consequences of shutting down. Now, what's happening in many of those centers, and we've been talking, you know, throughout, you know, the weekend with some of them that are trying to stay open, is that the situation is it's fixing itself as patients start to say, wait a minute, I'm not coming in for an elective procedure. So just try to make good decisions here. I want to talk a little bit about the future and what might be happening. You know, I know we've been talking a lot about what to do if you're shutting down, and please listen to previous podcasts if you want some advice as to what to do during those times. But one thing that we have learned is that right now the need in the community for facilities is for very large concentrations of individuals. The government is looking to be able to place hundreds or thousands of people in a large facility, in an area where they can concentrate the patients and the healthcare workers. So it's not likely that a surgery center is going to be used for that type of care. We do have a call in here. Let me let him in. Hang on one second. Go, Sarah. Well, that didn't work. These call-ins are not working. Oh, wait a minute. I'm sorry, Sarah, you're there. Do you have a question? Sarah, do you have a question? This call-in is not working. Sorry about that. So if you've been thinking that in the long term, your ambulatory surgery center is going to be called upon to do that type of work. I doubt it. However, we could be used for non-emergency room healthcare. So at some point where they're probably going to be coming to us and asking for us to take on those cases that we're not able to do, that they're not able to do in the hospital because of all the other demands. So be prepared for that. But in order to be able to do that, you're going to have to, I'm sorry, I hear something. I don't know.
Sounds like that's from Sarah.
Yeah, and I don't know why I can't. I mean, she's not showing on the board. I don't know why. Okay. Hopefully that'll go away. And I've learned my lesson. I'm not going to let people on unless they text me beforehand. And keep it local. As we talked about this morning on the New York State specific issue, contacting your local authorities is critical at this juncture. Maintaining contact with your hospital is probably the best use of your time. The government has more critical issues to deal with, so reaching out to them about the possible use of your center is probably not going to be very helpful right now. But use your contacts with the hospital to see if there's anything, or make sure that they're aware of your existence. We've provided some resources on our website, like example letters that you can send to the hospital, outlining what your capabilities are, and again, maintaining a good contact with them and volunteering to assist in whatever way is likely. So I think we're going to see most of our centers shutting down in the interim. But then as things progress, as hospitals get overwhelmed, I think that there are going to be opportunities for reopening. So what is happening, I don't think, is a permanent situation. And of course, many of our centers are shutting down also. Several of our centers are shutting down. Several of our listeners are shutting down because they've had a staff member or physician who has tested positive. So be very careful about that. And that becomes a very difficult issue. I do recommend that you contact the local health department when that happens and ask for their advice. There has been some conversation or discussion about the possibility of using our centers for testing. But to be honest with you, the other options are probably much more viable. We have some centers that are new that have not opened up yet that might be a good option to at least bring some revenue in, though we don't know what that would be during the interim while we're waiting to bring everybody on board. Our listenership has actually gone up rather than down in the last 10 minutes, probably because I'm just having this wonderful conversation with everybody here. So are there any other questions out there? Please so if you have a question, please input it in your, or put it on the Podbean app. Email us at comments@ascpodcast.com. Put it, if you're on the live stream for YouTube, put it in your comments there, or text me and I can let you on to ask the question in person. We do have another question. Go ahead, Sue.
She asked, if an employee has tested positive, is the center required to shut down entirely?
So this gets really difficult. What we are advising is that you contact the local health department for their advice. The problem becomes that you're taking some significant risk at that point, and you have to I don't know that there is a government mandate that you shut down. Again, you would follow the advice of your local health care, the local health department. But you're taking some significant risk if you continue operations. I happen to know the center that's asking this question, and they have had a positive ID. The problem is that particular provider had seen quite a number of patients prior to him being diagnosed. Actually more staff than patients actually in this situation. So be very, very careful, because again, you're taking on some risk. If you choose to stay open during that time frame, or during that 2 weeks that would between when that employee or the staff member was last in the center, I think you subject yourself to some legal problems. I don't know, Laura. I know we kind of talked about this before, but sometimes our audience comes in and goes out. Do you want to talk about that again?
Me or Laura?
Oh, I'm sorry, Laura, not Lori. Did I say, I'm sorry, I meant Laura.
It's all about me.
So the specific issue is if somebody tests positive in the workplace, and obviously being a medical facility, right?
Right.
You know, I think the protocols have been you contact the Department of Health, the CDC, look for direction. But you know, I would say obviously if you know you're there's an exposure issue, right? So
Yep.
Quarantine, it looks like that's the answer.
Yeah, I agree. And that's what I was trying to say in my long-winded way, is that I think, again, I don't know that there's a government mandate that you shut down, but you've got a moral, responsibility here, and you probably are subjecting yourself to some significant legal risk if somebody gets infected as a result of that individual spreading it to another employee or to patients. So if we're trying to be risk adverse here, then you probably need to quarantine for those 14 days after the last exposure.
The other thing to consider, John, is that if you have a known exposure in your center and you did not quarantine and one of your employees then passes it on to someone in their family who may have a very negative outcome, then your center's name is going to be out there for all the wrong reasons. And I don't know that, especially right now, that any center can afford bad publicity.
That's right. And that's a big theme. Thank you, Lori, because that is a big thing that I have here is that, keep in mind, everything that we're doing right now is going to reflect on what, how this industry is perceived after this is all over with. And it's important that we do the right thing here. I know I've said that a lot today, and including in my emails today, but I do think it's important that we consider our reputation moving forward and do the right thing here. Does anybody else have any other comments? Any other questions?
I have a comment, actually. I was in a center today, unfortunately for them, performing a survey, and they have decreased tremendously their the caseload, et cetera, and they're multi-specialty. And one of their specialties, other than like orthopedics and GI, et cetera, they've curtailed their GI procedures, which, that was their decision, which is fine. Now, during the survey, I went into the procedure room and I went into the anesthesia cart with the director. And this is not a negative thing, but it's something I think we're all trying to protect and make decisions, et cetera. Well, when I opened their drawer, they had some medications.
That's, by the way, for people that are not from Boston, that's a drawer, not. Go ahead, Lori.
You're so funny. So anyway, they had medications that were going to expire within a week. And I don't even think that we're thinking of that. If we're streamlining our center and we're going from 3 rooms to 2 rooms or to 1 room, think about the supplies that are in those other rooms so that we're not incurring more fees and things like that. If we can use that product first, then let's do that. It's just something to think about. It's not just what's in our cabinets, it's also what's in our rooms and in our carts. How's that? You like that? Is that
Yeah. No, that's a very good point, especially as we start to figure out, what to do with our supplies, during any shutdown period. So thank you. Any other comments from my staff here or Laura?
I just did want to mention one other thing that employers have to think about as well, whether you're going to furlough, layoff, is that the health benefits, while it's, we've been talking about continuing the health benefits, you need to look at your plans. It's important in terms of, the reduction of hours. If somebody goes from full-time to part-time, whether they still can be covered. Most of the plans, I think, are waiving those requirements, so they could be able to continue health insurance. But you need to look at your plans, especially if you have a self-insured plan. So just another thought.
Right. Thank you. A very good point. I did want to, so we haven't talked at all about what to do if you are shutting down, and we talked about that extensively, I believe, on Friday's episode. There's also a lot of information on our ascpodcast.com website. So there are a number of steps that you need to do if you are going offline, that you want to be prepared to be able to come back full strength when you come back online. And we've given quite a bit of advice. Those of you that are clients of Ambulatory Healthcare Strategies, trust me, we are already thinking about that and trying to make sure that we can keep you ready to come back on full steam when things happen. We've also mentioned this before. We are planning on some educational programs over the next, I mean, I don't know how long this is going to go on, but I'm just saying kind of a couple months to kind of keep you engaged. Hopefully use this downtime, if we can call it that, for educational purposes. So we are, that's actually why we have Studio 2 in the other room there, so that we can start doing some nice educational programs. So many conferences have been canceled that we do think that, especially those of you that have needs for CEUs and AEUs and IPCUs, we're going to dedicate ourselves to trying to do that for you, as well as get you up to speed on infection prevention, which is going to become even more important moving forward, as I'm sure Lori will attest to. I mean, she's working on some programs that will help you prepare to be an infection control preventionist, coordinator, or if you already are one, to have, to increase your skills there, especially in light of what's going on here and the fact that more now than ever, that's going to be a focus of surveys. So stay tuned as we start rolling out those things. Right now, we're still in crisis mode, so that's not on anybody's minds, but I want you to know that it is on our minds. Any other comments from our staff? Any other questions from our audience? Something buzzed. No. Okay. With that, I think we will end this episode. Feel free to send us questions at comments@ascpodcast.com. Join us again, and please consider becoming a patron by going to our website at ascpodcast.com. And we're trying to keep open during this time, and our expenses are going up, and I don't ask a lot, and I just hope that some of you will consider becoming a patron of the podcast so that we can continue the work that we're doing here and giving away all of this information to you and helping you prepare for what's to come. So please do consider going to our website at ascpodcast.com and becoming a patron. And also spread the word about the podcast to all of your friends and your colleagues, and do us the honor of hitting the subscribe button. If you hit that subscribe button, you'll know right away when we're going on air. The sound editor for this episode is Susan Cronkite. Executive producer is John Goehle. Research assistance is provided by Susan Cronkite, Jenna Alvarez, Judia D'Ambrosio, Alex Borneman, Zach Kauritis, Lori Rodericks, Laura Spring. Music is provided by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast channels.
This podcast is an education and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. We would like to thank our sponsors, Ambulatory Healthcare Strategies, Surgical Information Systems, Encompass Healthcare Data Solutions, and BHG Funding. For more information about our sponsors, please visit our website. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.